Today let's talk about what happens before an operation in the form of two different forms of consent in Baltimore, Maryland medical malpractice cases. When you go see a physician prior to surgery, a doctor is required to obtain your permission to perform the procedure. This is called informed consent. In all these cases, the patient needs to know the risk, the dangers, and the alternatives of the procedure. The second part is basically after the patient's been informed of all those things, the patient needs to consent to the procedure. In other words, a doctor can't come in and do any operation without some form of either express or implied consent. Express consent means simply this. When you're basically, and most people understand this, when you're in the operating room, prior to going in the operating room, the nurse comes in and you sign forms. Those forms are express consent forms. Also, in addition to that, you can give, in some circumstances, what's called implied consent. You can nod your head. You can agree to it without signing the form later. There are, of course, different forms of exceptions. If the doctor has an emergency and you're bleeding out on the table, doctor isn't required to get your express or implied consent. You don't have to sign under those circumstances, but basically, in all medical malpractice cases that we see, oftentimes we see these in cases where the doctor operates on the wrong body part. The body part has to be labeled. If they're operating on your right arm, for example, it has to say they have consent to operate on your right arm. They can't then go and operate on your left arm. It has to be very clear, written out. You have to sign off on it. And in circumstances where it isn't agreed to and isn't signed off on, you may in fact have a medical malpractice case.